Bismillahirrahmanirrahim. I'm Muhammad Sajul Islam Sarkar, again coming in front of you to discuss about the dead bodies of COVID-19. Can dead bodies of COVID-19 patients transmit novel coronavirus? Can dead bodies transmit coronavirus? That means I will try to discuss these related matters that we are frightening, we are fearing regarding the handle of COVID-19 patients, regarding the dead bodies of novel coronavirus. It's a very typical right now, and we are not attending in their funeral processions. And so far we have heard that some areas are refusing the dead bodies of COVID-19 to receive and to have a burial procession or funeral procession in their local graveyard, in their local funeral ground. So it's a very confusing and it's a very fearful and fearing matters right now. So I will try to make it clear what about the dead bodies of COVID-19. How much is it infectious? How much dangerous is it actually? So generally it's a common myth that persons who have died of communicable disease should be cremated. But this is not true. That means the persons who have died with communicable disease, the persons who have died with some infectious disease or contagious disease should be cremated, but actually this idea is not correct. This idea or this claim is totally false. So side by side I will try to make it understandable. Simply we need to make it understandable, need to make it more clear whether the corpses, I mean dead bodies, transmit the coronavirus or not. If yes, what should we do? Need to know how does coronavirus spread from the corpses. Dead body itself, we should remember, dead body itself doesn't spread the coronavirus actively. So but we are fearing, we are very fearful, we are very scary about the dead bodies, about the handling of the dead bodies of the COVID-19 patients. So I will try to make it clear. Can dead bodies of COVID-19 patients transmit novel coronavirus? I mean, can dead bodies transmit COVID-19 virus? The dead body of a COVID-19 patient transmit the novel coronavirus. This claim is totally false. I mean, the dead body of COVID-19 patients transmit novel coronavirus. This claim is totally incorrect. This claim is totally false. What about WHO? What WHO says? According to WHO, except in some cases of hemorrhagic fever, for example Ebola, Marburg and cholera, dead bodies are generally not infectious. I mean COVID-19 patients' dead body are generally not infectious. I will make it clear. Only the lungs of patients who have died with COVID-19 can be infectious. If dead bodies are not handled properly, this is said by the WHO, during an autopsy, there is a possibility to be infected. Otherwise, cadavers do not transmit disease. The WHO mentioned that those who are constantly in contact with the corpses or workers who routinely handle corpses may, however, in risk with some diseases. For example, tuberculosis. For example, hemorrhagic fever that I mentioned, Ebola, Marburg. Bloodborne viruses, for example, hepatitis B, hepatitis C, HIV, and gastrointestinal infections. For example, cholera, E. coli, hepatitis A, typhoid, paratyphoid, salmonellosis, shigellosis, rotavirus diarrhea. These diseases are so infectious, and the patients who have died with these diseases, we should be very careful during handling the dead bodies of these diseases. Okay, fine, we will take cautions during the handle of the COVID-19 patients, but these dead bodies, the dead bodies of these diseases that I have mentioned are more contagious, are more infectious, and are the most communicable to others than or in comparison to the COVID-19 patient's dead body. So what we have understand by this, that COVID-19 patients is comparatively less infectious in comparison to the tuberculosis, in comparison to the blood-borne viruses, for example hepatitis B, hepatitis C, HIV, also less communicable, also less contagious in comparison to the gastrointestinal infections, for example cholera, for example rotavirus diarrhea, for example E. coli, for example salmonellosis, shigellosis, for example typhoid, paratyphoid. These are so much infectious in comparison to the COVID-19 dead bodies. So another question, if I want to say, is there any evidence of infection from the exposure of the dead body of COVID-19 patients? As of March 24, these are the statements of WHO. As of March 24, there is no evidence of persons having become infected from exposure to the bodies of persons who have died from COVID-19, reports WHO. That means up to March 24, there was no record, there was no evidence that someone is infected or someone has infected due to the exposure of the COVID-19 patient's dead body. The WHO further adds, any body fluids leaking from orifices in the cadaver must be contained. WHO says again, there is no need to disinfect the body before transfer to the mortuary area, funeral area. And people who have died from COVID-19 can be buried or cremated. That means WHO says we should contain the body fluid of the dead body who has died from COVID-19, or we should bury the COVID-19 patients or can be cremated. And dead body of the COVID-19 patients should not be disinfected before transfer or removed from the isolation area to the mortuary ground. This is the statement of the WHO. Another question, is there any risk posed by dead bodies after disaster? Do dead bodies pose risk in epidemics? Here is what WHO says. There is no evidence that corpses pose a risk of epidemic disease after natural disaster. It's just contrary to common belief, and it's a common myth. Most agents, like different pathogens, do not survive long in the human body after death. It's very common that pathogens do not live long in the dead body, maybe for several hours. Human remains only pose a substantial risk to health in a few special cases that I have mentioned earlier, such as tuberculosis, blood-borne viruses. I have said, you can just follow this. So, constantly in contact with corpses may cause tuberculosis, blood-borne viruses, etc., WHO says. And this information, what WHO says about this information should be shared with both emergency workers and the general public also, who are constantly in contact, and whose workers who routinely in contact with the handling of the corpses or handling with the dead bodies. They should be know this information. Can a person who has died of COVID-19 infect others? What about WHO along with some doctors' views, doctors' statements I want to share here. Dr. Narasat Singh at MIT University, Dubai, told Gulf News. That means Dr. Singh, he is a scientist at MIT University in Dubai, told Gulf News as like, when an individual dies of COVID-19, the virus that is within in him remains within, as all physiological processes that could account for the spread completely stop. What does it say? That means the pathogens or the virus that is within the human system will remain within, and after death all the physiological processes, all biological processes and all chemical processes that are considered to help to spread the disease or to spread the virus are completely stopped. All processes that will help is totally stopped. Viruses will be remain within, but physiological processes of the host body will be completely stopped. We all know about this, that the biological process, chemical process and everything will be stopped after the death. So without the help of those processes, viruses or any other pathogens will not be capable enough to spread from his body. However, Dr. Singh also said the patient's body surfaces, like his clothes, some precautions he also said, the patient's body surfaces like his clothes, hands, etc., where the virus lurks, where the virus inside, will be very much a source of infection. As the virus continues to remain active on inanimate surfaces for several hours. That means Dr. Singh says that the cloths, the hands of the dead bodies, where there is a possibility that virus will be in lux or virus will be inside, there is a possibility to be infected, and we know dead body, okay fine, he is already fallen in death, but virus is not in death, so they will survive for several hours, and they will be active in an inanimate surfaces. So dead body is also a surface, so they may be active. And another scientist, according to Ben Dormelon, who also said about the stability of virus, the environmental stability of COVID-19 virus is about 3 hours post aerosolation. So virus will not die just due to the death of the patients. It will survive for several hours. It will survive for several times. So the hands, the lungs, and the clothes of the deceased person should be handled carefully. One important question right now I want to say, how much time does virus stay in dead body, or how much time does virus alive? It is unclear how long the virus stays in the dead body. In the absence of data on infection from dead bodies, the WHO is recommending proper disposal of dead bodies to prevent possible spread from secretions. WHO also says we have to use impermeable body bags before being removed from the isolation area to avoid leakage of body fluids. WHO also recommends use of leak-proof, use of waterproof and use of impermeable gowns to avoid body fluids, to avoid body secretions, to avoid body excretions from the dead body. That means WHO is recommending impermeable body bags before being transferred, before being removed, the dead body of the COVID-19 patients from the isolation area to the mortuary area. And he also WHO also recommending some waterproof, impermeable and leak-proof gowns for the healthcare workers. So since data is unavailable about the lifespan of virus within the dead body, it is unclear to us, and recommending proper disposal with some cautions. But actually, dead bodies are not infectious. Dead bodies of COVID-19 patients are not able to transmit disease, except its secretions, some body fluids, some secretions from the body. Another question is there any health risk, and what should we do during packing the dead bodies? What should we do? What shall we do? The widespread belief that corpses pose a major health risk is not accurate. That means we have a widespread belief, we have a common belief that dead bodies of COVID-19 patients will have a possibility to pose a major health risk, but this is not true. This is really false. This is totally incorrect. It's just a common belief within our people. And one more important thing, Pan-American Health Organization says, just contrary to WHO, that they says no need to use any body bags during the transfer or from the removal of dead bodies from the disease care site or from the isolation area, and they are recommending to use some cloths or normal tissue to wrap the dead bodies before being removed from the isolation area to the mortuary or to the burial ground. So actually we should make it clear that the dead bodies will not have the ability to cough, will not have the ability to sneeze. They are not taking air, they are not inhaling or exhaling the air. No air is coming from the lungs, and no cough, no sneeze from the dead bodies, right? So how can we say the dead body will transmit diseases, dead body will transmit novel coronavirus? One more thing, that we should take precautions from body fluids. We should take precautions from body fluids. We should take precautions from any secretions through different orifices of the deceased person, or any secretions, any excretions from the dead body. And one more thing, we should be careful about the aerosol from the airways that will come from the lungs. So what are the handling procedures of dead bodies of deceased person? Due to handling procedures, there is no evidence so far of transmission of COVID-19. The potential risk of transmission is considered low and can be related to direct contact. We should follow this. Infections are directly related to direct contact with human remains, human cadavers, direct contact with body fluids, direct contact with body excretions or secretions, direct contact with contaminated vomits, direct contact, that I have said, aerosol from the airways, and direct contact with surfaces at the diseased care site, and direct contact with contaminated hands of healthcare providers. Without those, there is no possibility to be contaminated, to be infectious, or to be infected from the dead bodies. Direct contact with splashes from the patient's body fluids, that I have said, or secretions or excretions onto the body, onto the hand or onto the face of the staff members, those who are involved, those who are in the handling process. If there have any splashes during washing or during any processions, during funeral processions, if there have any splashes from the body fluids, from the secretions or excretions from the COVID-19 patients onto the body or up to the body or hands or face of the staff members or healthcare members, those who are involved in handling these dead bodies for funeral procession, there might have some infection, there might have a possibility to be infected, otherwise no ways, because dead body has no power to do anything, and dead body will not help the virus or pathogens to be active more to help, because all physiological processes of the dead bodies are totally stopped, totally or completely stopped. No biological process, no chemical process, no physiological process, because without the help of receptor, without the help of some physical support, physical processes, virus will not be able, novel coronavirus will not be able to infect others. Another more precaution, that small particles, that I have said, small particle aerosol from lungs during aerosol generation procedures we should be careful about, because during positive pressure ventilation, high frequency oscillatory ventilation, sputum induction, nebulizer treatment, chest physiotherapy, airway suction, and etc. etc. During that aerosol generation procedures we should be very careful about. Otherwise, no need to be very frightened, no need to be ashamed, and no need to be very serious. And one more important thing that I would like to say, it's very sorrowful, it's very unfortunate for we people that some areas are refusing the dead body of the COVID-19 patients. They have a common belief that this dead body will be a hub of that area, that COVID-19 virus or novel coronavirus that should be spread from that area in a strong manner. So this is actually false. Dead body itself have no power to spread the disease, because it has no physiological functions, it is not in functional condition. So how it will transmit, how it will spread the coronavirus. So taking cautions, and by taking precautions, it is also allowable to have a good funeral position, to have a janaza, to have a washing the dead bodies. During washing the dead bodies we should be very careful so that no splashes of the water will be onto the face, onto the bodies, onto the hand of we people. If we are very cautious during this washing, we can easily do this funeral procession, we can arrange janaza, we can arrange all those procedures accordingly. So no need to be frightened, no need to be fearful, and no need to be in confusion, no need to be panic about the dead bodies of the COVID-19 patients. And it's very unfortunate that not only in our country, in different countries they are refusing, especially so far I have heard in India, Iraq, even Iraq, Iran, and they are refusing in the starting stage that they will not receive the dead bodies. Even it's so unfortunate that the children, the son, daughter, and other relatives are not coming to do the funeral procession, to do any funeral activities before being buried. So it's very unfortunate. we want to believe that every lives are very valuable to us, and every dead body is also respectable to us. So we should have a respect, we should have a correct knowledge, we should have a proper knowledge about the handling of the COVID-19 patients. I think these discussions will make you clear that dead bodies itself are unable to spread the virus, except some body fluids, except some leakages, except some secretions, except some excretions from the dead body. So if we have a precaution, simply Pan American Health Organization says no need to have a body bags to hand over or to transfer or to remove the dead bodies from the mortuary area, from the isolation area. So, and they have recommended, that I have uttered, that I have said, they have recommended to wrap the dead bodies with cloths or by the disposable tissue, and this will be enough. But we should be careful to have some secretions, to have any secretions from the body through the orifices of the cadavers. It's a simple procedure, I think, and if we are careful enough, then it will not be able to spread the disease. And according to Dr. Singh, that physiological functions that will help the virus to spread, to be capable enough to act more, are totally stopped due to the death. And ultimately, after some hours, that Ben Dormelon says the lifespan is only for 3 hours post aerosolization. So and this is unclear to us that how much actually alive a virus will be alive after the death. So no confusion. I think it will be very clear. It will very clear right now that COVID-19 patient's dead body, or the dead body of the deceased person who have died